we've been talking about achy backs, and another way to tap into treating this kind of pain is through massage. And there are different styles used, and Anita Schmidt is here to share some insight on maybe where to start. So Anita, we're going to talk specifically about lower back pain.
Okay.
And how massage can help, because I know you're going to have to be careful, very careful if someone's in pain.
Yeah, absolutely. Usually your lower back pain, you experience it here in the lower back, but it actually comes out of the glutes, because that's where those muscles attach, and you want to release this tension over here. You want to do that carefully, because you want to ease in, not go too deep too fast, because that will get her very sore the next day.
Right, so I was going to ask you this, because I've dealt with lower back pain, and that is true, that you definitely feel it in your muscles.
Yeah.
And so I'm assuming that that's just part of the inflammation process, but will loosening those muscles actually help stretching and massaging?
Absolutely. The moment we release it after, you know, like 10 minutes on each side, it will get much better. We do the rest of the glutes as well. The moment you get off the table, when you're done with your session, you will already feel the difference. And you go, ah.
Really?
Yeah.
So it's just
Helps.
as simple sometimes as alleviating the muscles.
Absolutely.
Because why do they get contracted?
Well, why they get it, there can be all kinds of reasons. If you have a job at a desk, you sit a lot or you drive a lot, that can get it really tight. Oftentimes it's a lack of core strength. You should work out a little bit more.
Yeah.
And
so show us some of your favorite things that maybe we can do at home for a loved one that's suffering back pain.
Okay, you want to start out of the glutes.
I mean, obviously you want to go to a licensed massage therapist,
right.
but if you're at home and...
Any kind of manipulation will already help a little bit. Always helps.
I think Dawn fell asleep.
She's awfully quiet already. So you want to work on this area here, and you can palpate it.
Okay.
Just knead it.
Who knew you were going to get a butt massage when you came into work today?
Right. And I get that reaction all the time. I didn't know my butt was hurting. I came in for back pain. But really, if we release this, this area lays down automatically. It's wonderful.
Okay. And I noticed you use your knuckles as well.
Yeah, this is kind of the intro, because you want to loosen it up before you go too deep. And you start kneading for a while. At some point, you want to go a little bit deeper. You can use your elbow a little bit. Don't do it too pointy, but like this. You can have a little bit force.
Do you have to
Don't
worry
start
about
out that
nerves and things like that when you start to go deeper like that?
Yes, you do, but this is a big muscle. This is the gluteus maximus. Don't take it personal. But we all have
it. It is one of the larger muscles in the body.
It is, and it is very strong, and you really need to show who's boss, because you need to go underneath there. So that's why you need to have a lot of pressure. You will... The sciatic nerve is running right underneath here. So once you release this, the sciatic nerve has a better time too.
Now, how much of this lower back pain can reach up into your mid back and up into your shoulders? Because a lot of us will carry stress up here.
Right, that's a whole different topic. That does not really. That usually comes with the stress that we carry in your shoulders, in your neck, upper back, between your shoulder blades, and that needs, well, this massage as well.
Yeah. How often do you recommend getting a massage? And would this be considered a deep tissue massage?
Yeah.
And that's what you would recommend if you're having some back pain?
Absolutely, and it depends on the person how much pressure you can take. So you need to talk about that.
Yes, and I'm glad you said that, because definitely when you go in for a massage that's for anything other than relaxation, if you have back problems, you definitely want to be verbal and say, you know, I'm really tender right here, you know,
right, and back off, because if you cause pain, you will tense up. So that's not working.
Yeah.
So absolutely.
Well, very good. Thank you. You put her to sleep. Good job.
Thank you.
You can reach Anita Schmidt at DutchTouchMassage.com, and we'll also have her phone number on our website at thebroadcasttv.com, and Dr. Jerry's information as well. By the way, when you contact Anita, mention the broadcast, and you'll get a 1-hour massage for $45. That's a great deal. Okay, we're back in the kitchen next with another great Italian dish from Campese's, and another chance for you to win a date night for 2. And then you go home and you have a massage.